Hello, my name is Dr. Dewan S. Raja. Today I will discuss about metabolic acidosis. What is metabolic acidosis? Metabolic acidosis is defined as a decreased blood pH, that is the negative logarithm of hydrogen ion concentration, less than 7.35, a decrease in plasma bicarbonate concentration less than 22 millicurie per liter, and a decrease in partial pressure of carbon dioxide. There is a loss of bicarbonate, gain of fixed hydrogen ion, so there will be acid in the body, buffering, both intracellular and extracellular buffering, in both intracellular fluid and extracellular fluid buffering, respiratory compensation, and late renal compensation. Renal compensation happens, but it takes several days. Initially, we have the respiratory compensation. Two types of metabolic acidosis: anion gap metabolic acidosis and non-anion gap metabolic acidosis. Anion gap is calculated from the electrolyte value as follows. Sodium, that is the anion, and we'll get the cation, bicarbonate chloride together, and normal gap is around 10 to 12 millicurie per liter. This value differ from laboratory to laboratory depending on the standard of sodium bicarbonate chloride. Sometimes sodium plus potassium is also added in anion gap calculation. So this number may be a little bit variable. What are the causes of metabolic acidosis? Anion gap metabolic acidosis, lactic acidosis as in sepsis or shock, or in hypermetabolic condition, suppose some type of epileptic condition, overuse of muscle, will get lactic acidosis. The tissue will get less oxygen. In the situation like this, sepsis, shock, and overuse of muscle in convulsion will get lactic acidosis. Diabetic ketoacidosis, usually seen in type 1 diabetes mellitus, also called DKA, renal failure, chemical like salicylate like aspirin, methanol, ethylene glycol like the wood alcohol and the antifreeze, paraldehyde. These are the toxic alcohols. Paraldehyde, this is sometimes used to manage some type of convulsion and also used to manage the patient with history of alcoholism. Isoniazid is an anti-TB drug, so they all cause metabolic acidosis, starvation, dehydration, and hypermetabolism. Too much exercise, okay, and without conditioning, that may cause the metabolic acidosis, and due to hypermetabolism we will also get lactic acidosis. Non-ion gap metabolic acidosis, renal loss of bicarbonate, renal tubular acidosis, that happen both in proximal convoluted tubule and distal convoluted tubule. Acetazolamide therapy, okay, that is a therapy used mostly as a diuretic and also used in mountain sickness, acetazolamide therapy. Gastrointestinal loss of bicarbonate, that is in diarrhea. In diarrhea, a person loses a lot of bicarbonate, so he becomes acidotic. Pancreatitis and pancreatic fistula, and ureterocolic or ureterosigmoid or ureterocolic anastomosis or fistula. Addition of acid, ammonium chloride, hydrochloric acid, oral calcium chloride in the system may lead to non-anion gap metabolic acidosis. Clinical features of metabolic acidosis depends on the underlying cause. pH less than 7.2 leads to decreased cardiac output, resistance to catecholamines, hypotension, and Kussmaul's respiration. Kussmaul respiration is a rapid, regular, and deep respiratory rate, mostly seen in case of diabetic ketoacidosis. Hypotension, we just mentioned it, hypotension. Okay, so hypotension, we got it, one. Okay, tachycardia. Okay, so there is tachycardia and weak pulses, nausea, vomiting, dysrhythmia. So the rhythm of the heart will be altered because metabolic acidosis is associated with hyperkalemia, high level of serum potassium. So that may lead that causes dysrhythmia if it is hyperkalemia. Evaluation, how will evaluate the patient? Arterial blood gas study, CBC, complete blood count, serum electrolyte panel, serum creatinine, burn, blood urea nitrogen, and glucose level. And also we test for the urine analysis. So these are the evaluation to diagnose the metabolic acidosis. Arterial blood gas of metabolic acidosis, if you look at that, we have three types of metabolic acidosis in terms of arterial blood gas. We have uncompensated metabolic acidosis, number one. Number two, partially compensated metabolic acidosis, and fully compensated metabolic acidosis. pH is less than 7.35. This is uncompensated metabolic acidosis. Respiratory system has not started compensation. Partial pressure of carbon dioxide is 35 to 45. Bicarbonate less than 22. So this is uncompensated. Then number two is the partially compensated metabolic acidosis. Respiratory system has started compensation. So there is hyperventilation. So the partial pressure of carbon dioxide has been decreased. pH remain acidic, minus 735. So it has just, respiratory system has started the work to compensate the metabolic acidosis. Here, this is fully compensated acidosis. Respiratory system has compensated, so our pH is again to the normal range. Partial pressure of carbon dioxide, still it is decreased here. It is decreased because of the compensation. Bicarbonate is less than 22. So this is fully compensated acidosis. We have to remember that metabolic system is blamed for metabolic acidosis. Metabolic acidosis is compensated by respiratory alkalosis. Yes, there is some renal compensation, but that comes after several days later. So due to respiratory compensation, how it is done? By means of hyperventilation to decrease the level of partial pressure of carbon dioxide. That is the idea. Okay, so hyperventilation is a way to compensate metabolic acidosis. Okay, you got that. Now, what is the treatment of metabolic acidosis? Treatment, we correct and reverse the underlying cause. Treatment of the underlying cause. So we must correct what are the problems and reverse the situation. There is insulin replacement of fluid in diabetic ketoacidosis. This is an example. So we need to give fluid, several liters of fluid, insulin intravenously to manage diabetic ketoacidosis. Okay, so in diabetic ketoacidosis, the patient even may have acetone breath or fruity breath in his or her symptom. Okay, and blood sugar level would be high. Maintaining the adequate tissue perfusion and oxygenation is important. Sodium bicarbonate will be infused if the pH is less than 7.2. Okay, if the pH is less than 7.2. Okay, pH, P small letter, H capital letter. Please make correction. Okay, one half of the, okay, so this is P small p capital H, that is pH, negative logarithm of hydrogen ion concentration, less than 7.2 will be sodium bicarbonate. One half of the deficit is corrected during the first hour, so it should be corrected gradually, not suddenly. Bicarbonate deficit we can assess by this formula. Okay. Hemodialysis may be required if there is renal failure. We must do hemodialysis. We can do it if there is renal failure. What are the complications of bicarbonate administration? There is some controversy. Bicarbonate is used in the management of metabolic acidosis, but bicarbonate use has also some drawbacks. Like what? It includes, there may be hypernatremia, paradoxical cerebrospinal fluid acidosis, hypokalemia, hyperosmolality, and cardiac arrhythmia due to bicarbonate administration. And that's all about the metabolic acidosis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.